It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the training also of your regular program.
The thyroid gland is an organ that is located in the anterior part of the neck, just in front of the trachea. It is butterfly shaped.
Health insurance is a type of insurance coverage that pays for health and medical expenses. Health insurance covers some or all of the costs of routine care, emergency care, and treatment for chronic illnesses. Health insurance companies charge their customers a monthly premium for coverage, and in exchange, the company agrees to pay all or most of the person's medical costs. Even under the most generous plans, insured people must pay various out-of-pocket expenses for medical care. Primarily, these expenses include co-pays and deductibles, which are upfront costs paid by the insured to medical professionals before they receive services. Health insurance plans fall into two broad categories. You have the private insurance, and you also have the public insurance. Private plans are available from health insurance companies and are most commonly obtained through employers. In contrast, public insurance is provided by the government to eligible individuals and families. On your favorite health TV talk show, The Physicians, we'll be discussing understanding health insurance. It's another day with the physicians where your health is our business. It's always a delight knowing that you are there waiting for your favorite TV health talk show, The Physicians. Today we'll be discussing understanding health insurance. My name is Dr. Martina Agbere. And with me, as usual, is my co-host,
Dr. Memuna Yusuf Kadri, and it's always a pleasure to be here, knowing fully well your health is our business.
will always remain our business.
So health insurance.
Health insurance.
Do you have health insurance?
Of
Let's
course.
start from there.
Remember, I'm the child of the government.
Okay. Oh,
So
sorry.
yes.
So it should be me saying that
You are
I have. No, because it's cheaper.
I'm actually protected.
No, but
huh?
because it's cheaper. Oh.
Because I'm protected, I want others to also enjoy what
Yes,
I'm
and
enjoying.
because it is cheaper. Do you know what it is to do out-of-pocket payment?
Now,
Don't go there.
I think this is the best time for people to actually key in
for health insurance.
For health insurance.
We need to let people know. See, there's the basic. There's the
start from
government one. There's the private one.
There's the private. There's the the public one.
There's the
and
private
yes,
one.
There's some people are not even aware that they can come together as a group.
In an organization, right?
Yes.
And then be under a health insurance.
Even the
We
market
need-
people.
This information today is very key. Thank
That is
God
why we're
we
going
have
to be
an expert.
discussing understanding health insurance.
Insurance, and it's
So if you
important.
are there listening, we're going to be talking about understanding health insurance for the basics, so that when you understand it properly, you would know how the right decision to take. We'll be back after the short break. We're on to your regular TV health talk show, The Physicians, where your health is our business. Today we'll be discussing understanding health insurance. And with me in the studio is somebody who is a double barrel. He's a medical doctor and also a CEO, MD of a health management organization. He is Dr. Uran-York. He is a medical manager with bias for health insurance, with, of course, 18 years experience in the insurance industry. He's the CEO of ROTHAUGE Healthcare Limited here in Lagos. And of course, he has tentacles all over. Dr. Uran-York, you're welcome to the program.
Thank you very much, Dr. Martina.
Doctor, you're welcome.
But,
You're smiling because you are...
No, health insurance for that, the people with money in medical.
Dr. Memuna, thank you. No, I don't.
Okay, so what to talk, you know what I want you to do for us? The topic, is understanding health insurance. And our viewers out there, we need you to break it down to the barest so that they can understand it. So that at the end of this program, we want to hear that most of them have decided, they've taken the decision to go in, to enroll, to get insured. So let's start with, what is health insurance?
Thank you very much, Dr. Martina. Health insurance, simply put, is just an insurance that you take out that will pay for the cost of health or medical care. As we know, there are routine care, there are emergency care. Yeah. There is outpatient care, there is inpatient care, that is when you are admitted.
Absolutely.
There is this surgical aspect of, caring for people. There's medical, dental, and others.
Okay.
So when you pay for a package, depending on so many things, whether you're single, whether you're family, whether you have kids now, and all that, you have to look at the package and pay for that package that best suits you.
Okay. As a family?
As a family or a single person, or you take it for the whole household, with helps, domestic workers and all that, because day to their life is very, very important.
Exactly.
So the good thing about health insurance is that when you fall ill, whether you have money or not, you just present yourself for care and you're treated. So basically this is the meaning of health insurance.
So health insured.
Yeah.
In case of any emergency or any case,
Routine
anywhere
care.
you can receive it. So what are the benefits?
Like I said before, in this country, we have very poor health indices. We have one of the worst health indices in the whole world. Perhaps better than some 3 countries, that are war-torn. We don't want to go into that.
Exactly.
You see, when you take out health insurance, you know that when you go to the hospital, you're not going to pay money out of your pocket.
Okay.
When you fall ill, you take decision immediately to go for health care.
Yeah.
You don't have to look for money from friends, colleagues, and all the family. You fall ill, whether you have money in your pocket or you don't have money in your pocket. You present yourself to a hospital. So now, you don't delay taking a decision to go to the hospital. Now, when you go to the hospital and you're treated, the health outcome becomes better because you did not delay. Because if you delay, you may get to the hospital when...
Every second counts.
Yeah.
So essentially, you become more productive because illness can make you sit at home. And then if you have to go and pay out of pocket, it further brings you into poverty. That is why we tell people that for this country, that 70% of payment to hospital are out of pocket. It's not nice at all. So health insurance is very key to eliminate out of pocket payment.
So in understanding health insurance, are there basics?
Yeah.
Are there basics of health insurance? So if yes, can you please pull us through?
Yeah, in understanding health insurance, one has to know the basics of health insurance. There are several, plans, but they're similar. You have some called gold, bronze, silver, gold, platinum, diamond. Most of the time, the higher plans pays for amenity. Imagine you say you want to go to the hospital, want to stay in a single room. You want a television there, you want a fridge there, you want
Like
newspapers
that's
there.
diamond.
Yeah, diamond, platinum. These are cosmetics, so to say, but we need them. Now, almost all the plans are comprehensive. Outpatient is treated, inpatient is treated, surgery to extent. Now, you have to look at what any plan covers and the amount of money for that particular plan and the hospitals.
Okay.
There are some hospitals that we call boutique hospitals.
Okay.
The people I talk to, they know. Maybe, yeah, they know. There are some hospitals called boutique hospitals. So, those boutique hospitals are associated with very high plan. So once you look at a health insurance plan, you will know the one that fits you and also fits your pocket.
Pocket.
Because
Very important.
healthcare is comprehensive on all the plans.
Okay. Even the place, even the
And they're going to use the same drug to treat you.
So it
In the
doesn't reduce
boutique-
the quality.
in the-
It does not reduce the quality of drugs.
Oh,
Yes,
really?
it does
Really?
not. So
But that is
I will
the
take you up on
misconception.
that
Exactly.
very soon. I'll take you up on that.
That's the
That doesn't-
misconception outside.
That doesn't reduce the quality of
It does
care.
not reduce.
Because I know that there are some that we use generic for, and they use another. We'll
And
talk
use
about
branded.
that. Continue. Just continue. Just continue. It's interesting.
So,
really
you
interesting.
know, there are some hospitals that are attached to some plan.
Okay.
But if you see a hospital that you've been using that is attached to higher plan, it then means that you have to go to the higher plan. Like as I said before, you know, healthcare is essentially the same. You know, but the higher plans, you pay more money, maybe because of the, amenity and other things. So when you understand, at times if you tell the, you know, health maintenance organization officers to advise you, they will advise you. Okay. So you buy the plan that, you know, best suits you, and you choose your hospital. You fill out your form. You get a health card. And after getting a health card, and they said the policy has started, anytime you fall ill, you go to the hospital. Quite frankly, some things have limits. There is no health insurance, you know, package in the world that can cover everything. So you have to know what is covered for you and what is not covered for you. If you don't have enough money to pay for a service, but most of the time, nearly all the services that will restore health are available. But if you want to pay for things that are not you know, available on your plan, the health insurance man can act like a surety for you that you will pay because you're on the plan. And again, they will negotiate the price of that particular service, so that they will give you a friendly discount, a discounted price to pay. You know, not when you come, you want to pay it out of pocket and all that. So basically, that is how, you know, health insurance works. You look at a plan, the plan suits you, you pay the premium once the premium paying.
Explain premium. When you say premium?
Well, what we call, this is essentially an insurance policy, just the way you pay premium.
Okay.
That is that fee that you pay for you to be covered up to a certain extent is called premium all over the world. Yeah, it varies.
Obviously.
So the premium you pay for bronze is different from the premium you pay for silver, different from the premium you pay for gold up till diamond. That is the highest plan. Okay. So many other health insurance companies, you know, call it different names. Okay. But you will know that it's just like the way hotels, you know, name their room.
It's true.
So this is standard, this is silver, but the
kings,
most important,
You have a bed to lie.
it's just to lie down and get up.
Deluxe, this is this.
You have a bed to
This
just.
is
You have a bed to
presidential.
just lay your head.
It's not just a bed, you know.
So that is how health insurance is. But I think, like this premium we're talking about, health insurance organizations like premiums to be paid for 1 full year.
Oh.
We like premiums to be paid for 1 full year. Why? Because if we calculate what we used to pay claims in a quarter, the remaining one can be in one investment, but not a risk investment, a very low risk investment, to give us some more money to take care of other people.
When we come back, you will tell us if somebody who has paid a premium and now his or her disease conditions like wipes the premium, what is expected of you? Don't say anything. Yes, when we come back, you talk more. So it's getting very interesting. He needs to tell us how the patient will manage if the amount he or she has paid for the premium is exhausted. We want to keep a date with the physicians out there. Stay tuned.
Say Health insurance, as the name implies, it means to insure one's life in order to have access to health. Take for instance, somebody is sick and he has already taken health insurance. Such person will be treated without being charged.
Well, I don't have any health insurance. I don't, but I know we have health insurance. Is it what we call HMO? Is it different? Is it the same as HMO? I don't know if it's the same, but I'm working towards getting one. But for now, I don't have.
Well, I don't have health insurance. So, and the reason is because, first and foremost, before you can take a step, you have to, something must happen. So things, you don't just take step on the particular. So I believe it's as a result of I have not been in an environment where it is needed.
No, I didn't have health insurance. Because of money.
I actually have health insurance, which my experience with health insurance in Nigeria is not really good. And the thing is, especially HMO, sometimes when you subscribe, based on the brochure that they will give you a different expectation and different delivery, which is one of the things that is discouraging a common Nigerian man to subscribe to such thing.
Yeah, it's very, very important. Yeah, it's very, very important because at least for emergency issues, at least for quick stuff. So
it depends. Health insurance is very important, but as far as I am concerned, it also depends. There are some people that they can afford health insurance. When you take health insurance, there is some sort of money that you need to be paid. That you need to always pay to the insurance company. So, and if you can afford it, it is good. But if you cannot afford it, and you are not a sickler, like you're not the type that always falls sick, of course, it's not really important.
Yeah, because there are times whereby you can just fall sick and you have cash with you at all, but your health insurance will cover it all.
Of course, yes, if in a workable country where there is a good regulation by government, of course there is a lot of benefits of health insurance, of course. For instance, there are a lot of kind of sicknesses, diseases, and unfortunate things that may happen to you at the time that maybe you are not financially buoyant or strong at that time, which health insurance can help you to cover such things.
Welcome back. If you have just joined us, you're onto your regular program, The Physicians, where your health is our business. And in the studio with me, we have Dr. Uran-York. He is a medical manager with bias for health insurance, the CEO of ROTHAUGE Healthcare Limited, which is an HMO, a health management organization. He's been telling us so much about the health insurance, and he's talked about the different packages that are available. And before we went on break, we tried to discuss why the premium is paid for 1 year. What happens if an individual who is ill and is ill health decides to wipe that amount that he or she deposited as premium? What next? Are they going to ask the patient to pay more? Because they've signed the contract. So Dr. Ante, let's come back to our premium. What happens if an individual who has paid so much for premium now, unfortunately, in quotes, becomes really ill in a couple of months, weeks, and wipes that amount? What do you do?
Thank you, Dr. Martina. That is the real reason for health insurance.
Great.
If, say, 1,000 persons pay a premium of 100,000 naira, you know what we have in the pool?
Yes.
Now, if any person falls ill and becomes that critically ill, it is from the pool we will take care of the person. Don't forget, we have agreed that no health plan can cover everything.
True.
There are limits, there are ceilings to some of the health services. There are limits. To some medical services, there are limits to surgeries.
Okay.
So if you become really, really ill and you don't get to your ceiling, the health insurance pool will continue to take care of you. Now, even when you get to your ceiling and there's not much money again, according to your plan, for the health insurance organization to be expended on you, that you are a member of the the group already has guaranteed you coverage. That is when the health insurance organization will go talk to your company, at times talk to your family.
And renegotiate certain things.
We probably not really renegotiate, but
That would be funny.
no. We not really renegotiate when you are ill.
No, not with the
Yes.
patient. Maybe if
The
they have reached the
organization?
ceiling, maybe the hospital that is managing the person.
Yes.
Maybe for fees or something like that.
Yeah, we will try to bring things
To
down,
get down,
and
yes.
involve your family and involve your company.
Yes.
The key thing is that nobody leaves you at that point.
Yeah, you can't be abandoned.
You cannot be
That is,
abandoned.
that is a major advantage.
You cannot be abandoned at that point. But in reality, these things rarely happen in practice.
Okay.
Because assuming you're going for elective care, and they say your surgical limit is 450, we can shop around for you to where you will get the care at a very good price.
Good price, you're right.
Okay.
Including public hospitals.
Yes.
Don't forget that we've been in this business for some time. We know the doctors. In private practice, in public hospitals. We know all of them. Sometimes we put the calls through and say, Chief, I have this case for you, and this is the amount of money you can pay.
Yeah.
If they don't do it for that member, they probably will do it for you.
All right.
Like I just tell people that, look, because of the length of the time I've been in this business, that I know at least 50% of Nigerian doctors that are older than me. I might not know the younger ones.
Okay. So you
Yeah,
relate to
maybe, yeah,
them
maybe,
because of
yeah.
their
Maybe
picture.
the older one.
Yeah, of the older
Older
ones.
ones,
So
yes.
that is how that thing works. So
So, are there medical conditions that health insurance doesn't cover? And
yes,
why?
yes. There are some medical conditions that health insurance does not cover. And the reason is simple. We don't cover illnesses associated with lifestyle, behavioral style. If you decide to...
See, all this high wave of BBL now.
No. The BPL will cover... No. Those are cosmetic surgeries. But they don't. But you can do some buyback. Like we don't do cosmetics at all.
Bariatric surgery to...
We don't... Health insurance does not cover those things.
But should be told, really. Shouldn't
Yeah, I
cover
mean,
it.
like even things
That's
like...
okay.
no, we don't cover
It's
those things.
cosmetic.
We don't.
Speak for yourself.
That's
oh.
cosmetic.
You see, we do...
It's cosmetic.
We do functional, we cover functional
disease,
functional
okay.
surgeries.
Good.
You understand? But in the like if you have injury to your teeth and mouth, in the process of trying to fix it, if they cover the lips that is torn, I mean you have enjoy some cosmetics from that one. Behavioral illnesses we don't cover. If you begin to smoke and you have conditions of the lung associated with smoking, if there is a link, if we know that there's a link,
That is the smoking that
That
led
you
to the
understand.
cancer. You not treat.
so
Wow.
if you do things like some health insurance organizations don't cover sexually transmitted diseases, and that is why most doctors know that if this diagnosis is made as sexually transmitted disease, that health insurance will not pay for it. They will probably just write maybe
Infection.
urinary tract infection and all that. So that we don't pay for injuries that arises from extreme sports. If you decide to go climb the mountain and you fall down and your leg is broken, no health insurance pay.
Infertility.
Health insurance should not cover infertility, but because of competition among the HMOs, some HMOs have started to write plans that cover some basics of infertility.
But normally they shouldn't.
Normally they shouldn't. Oh, you cannot, because because of the underwriting skills, people are writing back some things. Like when we started health insurance, when I joined health insurance in 2001, fibroid surgery was never covered.
You are right.
But we've seen the incidences and and the pool. So now we cover it up to some extent. So because of underwriting skills, evolving underwriting skills, some things that were not covered before, we are beginning to see them in coverages. And, mind you, I have seen so many HRO heads of big organizations that are ladies, not men.
Okay.
So,
Okay.
being a lady, she must have interacted with some, ladies that the real reason of even joining the health insurance scheme may be that they have that sort of condition to be cared for. So, it was from them that we started to see that some persons, the only reason why they want to join the program is because of an underlying illness. And this condition is fairly rampant. So we just top up what they should pay as premium and say, we understand. So skills are making a health insurance organizations cover so many things that were never covered before.
Excellency, thank you so much for coming on our program. It's been a delight having you.
My pleasure.
You have actually schooled us on understanding health insurance. The way I've been schooled, I'm sure my viewers out there have also been schooled. So thank you again for coming on our program. I'm sure we'll invite you to talk more on National Health Insurance Authority. So my viewers out there, thank you so much for keeping a date with us on your regular program, The Physicians, where your health is always our business. You cannot always pay from your pocket. Out of the pocket is not an interesting thing to do. My name still remains Dr. Martina Agberie. Till next time, stay blessed.
Thank you very much, Doctor. This was very enlightening in the sense that we understand that health insurance, what it's trying to bring is health equity, where you can have access to improved healthcare services that are affordable, accessible, and available. My name is Dr. Memuna Yusuf Kadri, and please kindly follow us on all our various social media platforms, Instagram, Twitter, Facebook. And if you missed any of our programs, our YouTube page is there. You can binge on so many episodes that would enlighten you and make you more health conscious. You want to be a part of the show? Our website is up and running. With just a click and fill the form, you'll be right here with us in the studio. Till next time, remain blessed.